have that problem. What happens when if that's what this comes down to, what do you predict happens?
Every member's accountable to their own district. I know when I go home and talk about health care reform, I hear a difference of opinion on a lot of the things that are in this bill. Everyone in the end is accountable to their own constituents. So we'll see what the Blue Dogs do, but as a group. But in the end, it's up to each individual to go home and explain to their constituents why they voted the way they did.
All right, Congressman, thanks for being with us. Appreciate it. And by the way, it's interesting to get a little different voice in the Democratic Party. I've got to be honest. There'll probably be retribution for coming on this show, but we appreciate you being here. Thank you. And coming up, Democrats want you to believe the government option is the health care's gold standard. But next, we go to Maine, where they've already tried such a system. That's straight ahead. Now, President Barack Obama says the government option is an essential part of health care reform, and Democrats in Congress continue to indicate that a government option is still on the table. So if their wishes come true, what would that option really look like? Griff Jenkins traveled to Maine, where residents there know all too well about the impact of a government takeover of the health care system.
Democrats in Washington have sent a clear message to the president and the American people. They want a public option.
The need for a public option is very clear, and as I have said, our House bill will have a public option.
But a short trip to the land of lighthouses offers a daunting look of how a public option might fare at the national level. Maine's motto is Dirigo, Latin for I lead, and that's just what Maine did in 2003. They signed into law the state's first attempt at a so-called public option government-assisted health care plan. It was named, appropriately, Dirigo Care.
6 years ago, Maine instituted Dirigo Health, as a government option after advocates made the same promises about what it would do to bring down cost and increase access that the advocates of a nationwide government health care plan are making right now here in Washington.
Dirigo had three major components that, when compared to Obama's plan, the similarities are startling. First, it sought to cover all of the uninsured.
My plan will provide more security and stability to those who have health insurance, offer quality, affordable choices to those who currently don't.
Second, it was to be paid for by government-created savings.
We've estimated that most of this plan can be paid for by finding savings within the existing healthcare system.
And third, it promised no new taxes.
You will not see your taxes increased a single dime.
So how is Dirigo supposed to work for Maine's small population of 1.3 million? Trish Riley is the state's director of the Governor's Office of Health Policy and Finance.
Well, it's a comprehensive reform. It was designed to address costs, quality, and access to health care. It's very much more than just an insurance product. It built on the Medicaid program in the state to make sure the lowest income people had coverage. It then created a subsidized health insurance product on top of that for those people, particularly on Medicaid, who earn a dollar too much and fall off the cliff.
It was a noble goal, says Maine's current Speaker of the House.
It was exciting. I mean, it was a step in the right direction. It was a step towards universal health care. The entire idea behind Dirigo was it was health care based on your ability to pay. So we would offer people discounts or vouchers so that they could buy insurance.
For the most part, the folks of Maine looked favorably upon the attempt.
People actually were into it. It sounded beautiful. I mean, we're going to insure 140,000 people who have never had insurance or have bad insurance, and we're going to do it in a very cost-effective fashion. What's not to like?
Yet 6 years later, the Dirigo experiment has turned out to be a colossal and extremely costly failure.
So what went wrong with Dirigo? Taryn Bragdon of the Maine Heritage Policy Center says the program failed in practice.
What happened with Dirigo is we set up this plan that was very, very heavily subsidized, and people flocked to it. And then because people got something for very little cost, utilization went through the roof. And so premiums just skyrocketed, up 74%.
Joe Bruno was the State House Republican leader at the time of Dirigo's inception. He now sits on the board at Dirigo.
It doesn't work. Dirigo has not even come close to fulfilling its promise of covering the uninsured in the state of Maine. We can't provide this plan to everyone because we're not getting enough revenue in the plan. There's not enough cost savings in health care in the state as defined by the plan to fund more people.
Dirigo, just like what Congress is trying to do, said we'll cover you at any time, no matter what, with no pre-existing condition exclusion. And that's what drove up costs. People cycle on when they're sick, and they cycle off when they're healthy. They get sick again, they cycle back on. And the program is structured in a way that encourages that.
Dirigo was slipped up by a number of different things, and so I would say it was a valuable experiment.
So here's the question. Is Dirigo a true public option, like the one President Obama has been pushing for?
It doesn't set the benefits. It doesn't set the rates. It doesn't set even the premiums are negotiated with the carrier. It is run as a fully insured product by a fully licensed private insurance company. So it's a public-private partnership.
The governor's point person, Trish Riley, says this is not a public plan.
I think that's completely disingenuous. Her own Dirigo Health Agency administrator describes the Dirigo choice as a model of the public plan under Obamacare.
At its highest level of enrollment, only about 15,000 Mainers were covered under Dirigo. Today, it's less than 10,000. That's a far cry from the original goal, which was to cover 128,000.
Despite initial promises, it has not covered most of the uninsured. And yet it's led to higher taxes on thousands of Maine residents.
Originally, it was supposed to be paid for by government creating savings in the healthcare system, similar to the rhetoric we're hearing from Washington. But what we've seen is the plan's bankrupt, and just this year, the legislature passed a new 2.4% tax on private health claims to pay for it.
Senator Collins, for example, has discussed the problems they've had in Maine as a result of its attempt to create a government-run health plan.
Do you oppose the public option because of what you saw happen in your own state of Maine with Dirigo Health?
I oppose the public option for philosophical reasons. I don't think that the government should be competing with the private sector. I also am aware of what happened in Maine with the public plan, and it did not live up to the promises, a lot of the same promises that are being made now.
Maine's other senator, Olympia Snowe, was the lone Republican on the Senate Finance Committee to cross party lines and vote for the Democratic health care bill. But she says she's still skeptical of including a public option.
I have shared my Republicans' concerns about vast governmental bureaucracies and governmental intrusions. That's why I oppose the amendment for the so-called public option.
She says the experience in Maine has played a part in those concerns.
Certainly it is a basis for understanding that public approach experience. That has been an expensive option in the state of Maine and has not been able to meet its goals, and because it has been so expensive, so it hasn't been able to insure as many people as originally projected. So it is an experience that we have to consider as we move forward in examining the public option approach that has been proposed by so many here in Congress.
The experiment in healthcare here in Maine that has a government component and some call a public option has been met with dire fiscal realities. Premiums in the plan continue to rise and enrollment has been capped. All results perhaps the leaders in Washington and President Obama may want to consider before signing such a plan into law.
For a state of 1.3 million people, having a bankrupt plan is bad enough. But if you're replicating it to 300 million patients across the country, that's a disaster.
And coming up, the president has made a lot of promises about what a health care overhaul will mean for you, but do his claims stack up against the evidence? That's all coming up straight ahead. A government health care takeover could drastically change the way you and your family receive health care. Now, the president has made a lot of claims about what his overhaul will bring you, but are they true? We've asked some experts.
Our first recurring nightmare on our list: what will President Obama's health care reform cost you, the average American?
So this is what health insurance reform will mean for the average American. It will mean lower costs, more choices, and coverage you can count on. It will save you and your family money.
But would it really? Robert Moffat, a former official at the U.S. Department of Health and Human Services under President Reagan, says Americans should be ready for health costs to skyrocket.
There is nothing in the House or Senate bills that will enable Americans to have the kind of cost control that the president is promising. If you look at the House bill, which is a $1.3 trillion bill, there's going to be a very significant increase in health care spending, and there's going to be an increase in health care cost. In the Senate bill, the one that has just been released by the Senate Finance Committee, You're going to have new taxes on health insurance. You're going to have taxes on drugs. You're going to